Good day. My name is Mark Peltier. I'm the Chief of Cardiac Surgery here at Yale School of Medicine and Yale New Haven Health Hospital. In the United States, every year, approximately 300,000 women die from heart disease. We think of cancer as being the biggest threat to our lives, especially in women, but actually, heart disease is responsible for more deaths in the United States than any other disease, even beating cancer. For women, oftentimes the treatment of choice for their heart disease for blocked arteries will be coronary bypass surgery. The problem in this instance is that arteries that supply fuel and oxygen to our heart, those arteries become blocked, and the solution is oftentimes to take an artery or vein from somewhere else in the body and to bypass that blockage. Hence, we call it coronary bypass surgery. Women do enjoy the benefit of hormonal production until they reach menopause, but for many women, they've not had any perimenopausal hormonal treatment, and we know that coronary artery disease can accelerate after that age. Women also are more prone to microvascular disease, where the blockages are really in the small arteries that touch the heart, and they often present later. They present later in life, sometimes 7 to 10 years later than the average male, which means that by that time, they often have other comorbid diseases, maybe a bit more renal failure. They're maybe a little bit older, their bones are maybe a bit more osteoporotic. But more importantly, women often present with symptoms that are a bit different than men. Men often present with pain in the chest or crushing pain in their chest, which is typical presentation for angina or heart attacks. For reasons that we don't always understand, women may present with symptoms that are typically a bit more vague, with dizziness or fatigue or nausea or stomach pain, sometimes pressure or pain in their chest, but often symptoms that are a little bit less specific. For men and for women, there are strong reasons when we would want to consider coronary bypass surgery. Specifically, that would be for people who have disease in their left main coronary artery, so that's the main artery supplying blood to their heart, especially when they have disease in all three vessels on their heart, and especially when their heart function is already a little bit affected and down. Especially people that have three vessel disease with diabetes, that combination particularly is helped by surgery, which will help them live longer and have a better quality of life. Thank you.